The Senate Committee on Appropriation is faulting the implementation of President Muhammadu Buhari's National Social Investment Program. At a budget defense session with the special advisor to the president on the program, Mrs. Maryam Uwais, committee members are also querying the lack of clarity of the beneficiaries of the 500 billion naira appropriated for the program annually. The chairman of the committee, Senator Danjuma Goje, maintains that the impact of the program is yet to be felt and is asking for the names of the beneficiaries of the program from various states. But Mrs. Uwais, in her response, explains that the program has been affected by inadequate releases, as 90 billion naira was released in 2016 and 85 billion naira from the 2017 budget, despite the appropriation of 500 billion naira each year.
Members of the National Assembly are also not happy with you. Many people complained that they have not seen the impact of this project, notwithstanding the magnitude of the amount involved. For me, I want to tell you, I am from Govt State. I represent Govt Central. This project has been there for how many years now? Is it 2 or 3 years? I have not yet seen one single boy who has come to tell me that he has benefited from your 500 billion naira. You have all got your way 500 billion naira approved with no deduction of 1 naira. So because of this and many other things that my colleagues will bring, we feel you have to explain to Nigerians how far this your program has gone.
Under conditional cash transfers, we have 297,973,000 households that we're paying. We have a school feeding program. So far, we have 7,487,441 pupils being fed daily in 22 states by 75,333 cooks in 33,981 primary schools. We're set to commence feeding in 6 more states.
More stories now. At least 2 persons have been killed in a robbery attack on 2 banks in Offa, Kwara State. Channels Television learned that the gunmen attacked the banks this evening, shooting sporadically and forcing residents to flee the area, and shop owners had to close their businesses for the day. The attack was carried out in the Sani Abba area of the town.
The fact remains that there was a number of operation in Offa, where some banks were attacked by hoodlums, and as at now, our policemen are still on ground to give us the details of what transpired. But the fact is that actually robbers were in Offa town. They struck in some banks. And until we got the full details of what happened, I cannot say here now that this is exactly what happened, but we have a number of operations in Offa. We lost some policemen and some civilians, but I can't give you, for now, the details of what happened.
At least 6 persons, including a village head, have been killed following an attack by gunmen in Sarari village in Chikum local government area of Kaduna State. An indigene of the area told our correspondent that the attack, which left about 8 people seriously injured, occurred Thursday afternoon. The source says that the bandits who stormed the village on motorbikes went from house to house, shooting the villagers indiscriminately, and the village head was shot in the process. According to the eyewitness, the injured victims have been rushed to a primary healthcare center in Udwa town, 2 kilometers from Chikum-Birningwari border. The Kaduna State Police Command is yet to confirm the incident. The senator representing Kogi West in the National Assembly, Dino Melaye, has filed an appeal at the Supreme Court, seeking an order restraining the Independent National Electoral Commission, INEC, from proceeding with his recall from the Senate. Senator Melaye's appeal is sequel to a judgment delivered by the Court of Appeal on March the 16th, which cleared the coast for INEC to continue with the recall process. In a notice of appeal filed by Mr. Mike San Zekome, the senator is also asking the Apex Court to set aside the judgment of the Court of Appeal and to declare the recall process as illegal, unlawful, wrongful, unconstitutional, invalid, null and void, and of no effect whatsoever. The Court of Appeal had, in its judgment, dismissed all the grounds of appeal filed by Senator Melaye, holding that the 90 days stipulated by the Constitution within which a recall process will take place has no time limitation, as it can be extended. You're watching the news at 10 on Channels Television, reaching you live from Lagos. Let's quickly cross over to our Abuja studios, where Ibrahim Adra is standing by to take us through. Ibrahim.
Well, it's Mark West standing by here. It's good to see you, Gimba. The Inspector General of Police, Ibrahim Idris, has announced the reinstatement of the former Commissioner of Police in Kogi State, Mr. Ali Janga. His reinstatement follows his ability to beat the one-week ultimatum given to him to rearrest the 6 suspects that escaped from police custody on March the 28th. 13 persons who aided the suspects in their escape from custody have also been arrested. Mr. Janga was removed on the orders of the IGP shortly after he announced the escape of 6 suspects, including 2 men who had named Senator Dino Melaye as their financier in various crimes. The police authorities also announced that Mr. Sunday Ogbu had been deployed to replace Mr. Janga as Kogi Police Commissioner. Now, the National Health Insurance Scheme has wielded the big stick on 23 out of the 57 health management organizations over their inability to offset debts owed to health facilities across the country. The chairman of the Governing Council of the scheme, Dr. Enyatu Ifene, explains that the 23 health management organizations were delisted for failing to submit letters of non-indebtedness, to the scheme after several demand notices. Dr. Ifene says it will no longer be business as usual for health management organizations involved in sharp practices, as the Governing Council is determined to ensure the enforcement of regulations governing the National Health Insurance Scheme.
Any HMO with negative results, we know, is a risk. We had 2 categories of HMOs in this regard. Some HMOs had negative results that have completely eroded into shareholders' funds and gone further into debt and are not now considered for evaluation. In our interactions with healthcare facilities last week, it was very evident that many healthcare facilities have become demotivated because of the debt that they're owed. Some of these debts date back as far as 2012.
While staying with health issues, the Benue state government is seeking help from medical practitioners to address the huge health challenge among the over 170,000 internally displaced persons taking refuge in 7 IDP camps in the state. The Commissioner of Health, Dr. Cecilia Ojabo, made the call during the flag-off of a 3-day medical outreach by the Nigerian Air Force Medical Corps at the Abagana IDP camp in Makurdi. The medical outreach became necessary following the death of 6 IDPs, mostly children, who were worst hit by the humanitarian crisis, starvation and malnutrition among the over 86,000 displaced children.
For 3 months running, local farmers and vulnerable groups like women, the elderly and children have been displaced from their communities in Guma, Logu, Agatu, Okbuku and Makurdi local councils. The state of affairs at the IDP camps, built to accommodate far less than 10,000 persons, now accommodate between 15 to 34,000 IDPs. The health implication of overcrowding here is the outbreak of communicable diseases like cholera, malaria and diarrhea among the IDPs, and the Nigerian Air Force is here to address these challenges. The medical team begin with physical examination of IDPs and recommends appropriate treatment for the individual health challenges. The Air Officer Commanding Tactical Air Command Makurdi speaks on the areas and extent of coverage.
For the next 3 days, we are targeting about 4,000 people to be treated. So are treating virtually we are taking care of the primary health care. We are looking at the eyes, the ophthalmologists are here, the pediatricians are here, the nurses and even the health worker. We are looking at the sanitation also. The surgeons are also here also to do what to take care of those that have that need surgical operations.
The Commissioner for Health and Human Services, while addressing the IDPs, urged them to take advantage of the medical aid, as she beckons on medical practitioners for support.
We've been battling with the health challenges because the population is overwhelming. Our doctors at the general hospital level have been on strike, so we have to employ the services of the nurses because the community health extension workers could not face the challenges. Even though my doctors from the ministry are supervising and seeing patients, but the hands were not enough. So for this offer for 3 days in the camp, we appreciate it.
With the 3 days health intervention, part of the humanitarian crisis is being addressed. But food shortage, inadequate water supply, and the need to step up security for the safe return of IDPs would have been appropriate at this time.
Lawmakers from Benue State in the House of Representatives are worried about the withdrawal of military personnel from troubled communities in the state as the exercise cat race winds up. They say that the withdrawal exposes residents of Benue State to more herdsmen attacks, since, according to them, there is no clear evidence that the killer herdsmen have been disarmed. The most recent attack occurred on April the 3rd in Agasha town, Guma local government area of the state, where 2 persons were killed and 3 others injured by suspected herdsmen. They are asking the federal government to deploy a proper military operation to Benue State and station military units in restive communities until the herdsman menace is fully curbed.
We are very seriously concerned and alarmed at the withdrawal of the personnel of exercise catcheries from Benue when the herdsman menace has not been curbed, and the reasons for their continued deployment to other states in the region, which has left Benue even more vulnerable and has paved the way for the recent despicable, premeditated attacks by herdsmen in our communities. We view this decision as very suspicious, condemnable, and ill-timed, ill-advised, and leave us to wonder about the military strategy or lack of it in the fight against the killer herdsmen. We are worried that there is still no evidence of the disarming of these killer herdsmen by the military, police, or other security agencies. We are calling on the federal government to immediately explain to Benue people and Nigerian people why the cat race exercise has already been terminated in Benue without a resolution of the issue, and want to demand that the federal government deploy a proper military operation to Benue State and station military units in restive communities in Benue until the herdsmen menace has been dealt with.